live now. Good morning, good afternoon, and good evening, ladies and gentlemen, wherever you are joining us from. My name is Michael Watson, and I am the regional lead for the Microsoft Reactors in the Asia Pacific region. It's my absolute pleasure to welcome you to another fantastic Microsoft Reactor session featuring Regional Director David Goad, PhD. Just to give you a bit of background on David, David has extensive practical experience in information technology and business strategy, having started up his own successful IT services business, which won 12 national and international awards for sales, innovation and service before he sold it. In his career, David's managed a number of high-performance corporate sales teams and is well known throughout Hitachi, KPMG and Microsoft for his consulting services. In David's spare time, he's an instructor with the New South Wales Rural Fire Service, which is a fantastic thing, and also is involved in the St John's Ambulance. So we are very grateful to have David join us for today's session, which is the top 10 technology trends in healthcare. Just before we kick off, we certainly encourage questions, so please put them into the chat. And I will be sure to collate them and we will work towards answering them at the end of the session, or if not during, if we have time. But without further delay, I will now hand it over to David. Thank you, David.
Thanks, Michael. Hi, everyone. Hope you're having a good day so far, wherever you are in the world. So the topic of today's session is the top 10 technology trends in healthcare. This is a session I've done for a few clients over the last year, and so I'm just repeating this here in terms of sort of interesting things are going on in healthcare from a technology perspective. Excuse me. So my agenda today will be as follows. Just do a little bit of brief introductions. I just want to set the scene a little bit around this issue of technology disruption and what's going on, this idea of digital transformation versus digital optimization, and just present to you perhaps a little bit different perspective on technology than what you're used to. And then I'm going to go through the top 10 technology trends and give you some examples of these trends in the healthcare context. So the actual list itself is based on a Gartner research report in terms of the actual topics, and then the ideas and the projects in that are ones that I've seen out in industry and have some exposure to. And then we'll just do a little bit of conclusions, and I'll open it up for see if there's any questions that people might have. So as Michael said, my name is David Goad. I have a PhD in Artificial Intelligence and IoT from the University of Sydney. I've been working in the technology space for a very long time, had my own business. I teach both at the University of Sydney and the University of New South Wales business schools on digital strategy. And I do a lot of consulting for enterprises in a number of different sectors, including the healthcare sector. I'm also a Microsoft regional director. So a lot of what I'm going to talk to you about today is very much from a practical perspective with regards to technology and technology strategy. So I just wanted to introduce a little bit, or begin the presentation by kind of giving you a little bit of my worldview in terms of what's going on at the moment with regards to technology, right? And I think that, and this is actually a concept that's been introduced by Gartner, and they talk about this idea of digital optimization versus digital transformation. So on the one hand, you've got organizations, healthcare organizations, commercial businesses, public sector, driving change, demanding that they need to do things differently, and then technologists like myself responding to that and providing them with technology solutions. I think what you're seeing more and more over the course of the last few years is that technology is actually driving the change. What's happening is things like artificial intelligence and the IoT are presenting new ways of solving old problems, particularly in the healthcare space. And you're seeing that that's actually generating quite a lot of change in terms of how organizations work, both from a healthcare perspective and a commercial perspective, right? So as I said, Gartner talks about, on the one hand, you talk about business optimization, where you're using technology to make things better, right? Based on requests from operations, healthcare organizations, these kinds of things. On the other hand, you have technology now driving a lot of the change and creating whole new business models. And I would say to you, particularly in the area of COVID, over the last year, I've seen a lot of new technology coming out and a lot of new startups. So one of the things that I do as part of my role at the University of Sydney is actually coach startups as part of the Sydney Genesis program. And what I've seen is that there's a lot of new startups coming through related to healthcare and related to the issues that have been generated by COVID. So things like remote healthcare, how do you manage prescriptions remotely? How do you get people connecting with doctors and allied health professionals and these kinds of things? There's a lot of new business models coming out and being driven by what's happened in COVID. I think the other thing, sorry, back to that slide, the other thing I should point out is, regardless of what was going on in COVID, regardless of what we had over the last year, the whole healthcare space is a space going through upheaval. And the reason why it's going through upheaval is because a lot of people recognize that we are heading towards a problem, particularly in Australia, where the demand for healthcare is going to outstrip the supply. So by a lot of accounts, within the next 10 to 15 years, because of the aging population, increasing demands in terms of healthcare, the healthcare industry is going to be struggling to keep up with the demand, you know, from individuals and from our older population. So it's not just going to be about, you know, building more houses, training more doctors, having more nurses. It's about how are we going to utilize the assets and resources that we have more efficiently. And so that's one of the things that we'll talk about in today's presentation. Now, if you buy into this idea that, you know, it's not just the operations or healthcare that's driving the change and requiring technologies to support that change, but that technology is actually driving change itself in the healthcare industry, then what that tells you is that as healthcare professionals or individuals who work in the healthcare industry, you need to understand technology more. You can't sort of take the perspective that, you know, I focus it from a healthcare perspective and then the technologies come in to support it. It's more important these days than ever, more than ever, to actually understand how these technologies can be used to improve the patient care and to improve people's quality of life. So what are the sort of top 10 technology trends in healthcare that are going on currently at the moment? I'll go through the list. I'll give you some examples, and then, as we said, we can open it up for questions at the end of the session. First trend that Gartner talks about is this idea of hyperautomation. People used to talk about artificial intelligence, right? Then they talk about simply about robotic process automation. So AI is making machines that look, feel, and act more like human beings. Robotic process automation is where you're using tool sets to do manually repetitive tasks. And then you had, you know, business intelligence or BI tools on top of that to provide you with advanced analytics and advanced diagnostics in terms of patient care. What you're finding now is that both from a back office perspective in terms of the administration of healthcare and also a front office perspective, people are combining these three technologies or types of technologies together into what they refer to as hyperautomation to basically provide assistance both to the administrators and also to the healthcare professionals in terms of how they make patient diagnosis and how they make decisions. And I'll give you a couple examples of these. So for example, the first example I would use is a company called Max Healthcare. They're based out of India. They're one of the largest hospital networks in North India, and they deal with a lot of patient transactions on a daily basis, including inbound email inquiries, claims processing, and reconciliation of government healthcare schemes. And this was all manual. So what they've been doing now is they've been using RPA tools, in this case UiPath, but Microsoft has their own version called Power Automate or Power Automate Desktop, right? Where basically they're using it to automate manual transactions, sending emails, typing information into their business system, these kinds of things. And the whole idea is that these RPA tools can provide a faster turnaround in terms of these transactions and provide better responses to the patients who have queries about their claims, about their insurance, and these kinds of things. Okay, so this is an example where you're using you know, these sort of hyper automation tools and these RPA tools to be able to provide better support in terms of service to the patients. And in these kind of cases, what they do is they might be using the AI tool, for example, to read the inbound email, to be able to classify the email in terms of the question and what the patient is looking for. And then they might be able to use RPA tools to be able to automate the process in terms of what happens. From a clinical perspective, one of the biggest uses of technology is in terms of machine vision. So for example, in China, you have a company called Infravision, who what they're doing is they're using machine vision to basically support CT scans. So, you know, if you're a radiologist, you might be looking at hundreds of scans a day, right? And you might not be, you know, and people are human beings, you might make mistakes. So what they're doing now is they're using machine vision to identify and categorize the CT scans to be able to identify, you know, of the 100 CT scans that you're looking at, here are 3 or 4 that, you know, really, Mr. Radiologist, you need to go and have a look at them and focus on it more closely because there may be something bad going on. All right, so machine vision is probably one of the forms of AI that's gotten the biggest take up in the healthcare space, particularly because of its ability as a diagnostic tool. Healthcare trend number 2 is this concept of what they refer to as multi-experience. This is what Gartner talks about. Is the idea here is using a number of different technologies. It could be everything from conversational agents to augmented reality, right? To be able to modify and enhance the way people look at the world and the way they do various things, right? And to facilitate not only training into part of the doctors and nurses, but also diagnosis as well. So I'll give you some examples of that. So for example, they've got a little tool here that they're using, which is basically a vein finder. I don't know if the actual video will play in this case. We won't play the video just because I'm not sure if it's going to play over the thing. But basically, it's a tool that they scan on top of the patient's actual skin and will actually indicate where the veins are to allow them to be able to cannulate the patient. So you know you have that's an AR type tool set. You're also seeing the use of AR and VR tool sets in terms of doctor training. Here's on the right hand side, you have an example of an AI powered chatbot that is being used for diagnosis in terms of people being able to contact and then basically be able to ask questions and provide them with feedback in terms of, you know, what they might need from a healthcare perspective. So that's another example of using, you know, various tools to provide a better patient experience. Sorry. Another example that are a little bit closer to home. This is at the University of Sydney, which is one of the areas where I work at the University Automation Innovation Hub. This is what we refer to as CoronaBot. So when we had students last year in March or April, when there was a bunch of upheaval in terms of lockdowns and people couldn't travel and that kind of thing, all the students had a lot of questions. So very, very quickly, we knocked up a conversational agent called CoronaBot, and the students were able to basically ask questions specifically about how they could, you know, deal with the changing mobility and the changing rules and regulations that were coming in with regards to the COVID lockdowns and the travel bans and these kinds of things. And what you've found is not just the University of Sydney, but lots of other universities and organizations have spun up these conversational agents to help people through the process of, you know, answering their questions, you know, in terms of how they're going to manage COVID and that kind of thing. So that's another example of this kind of multi-experience that I would talk about, or trend number 2. Trend number 3 you're seeing in terms of technology is what I refer to as democratization. And what this is referring to is that from a technology perspective, it was always, you know, difficult to find good resources, good. All right, I can keep going.
Yep. I can see it. It's gone live. If anyone who's out there could just pop in the Q&A that they can see it, that would be great. But I think we're good.
All right, apologize for that. A little bit of technology issue. Yeah, so this whole idea of what they would talk about with regards to democratization. This is as I said, this is in response to the fact that it's hard to find technology resources to do all of these technologies. So a lot of the vendors, including Microsoft, have come up with tool sets to make it easier for people to build applications and tools themselves, not only from an AI perspective, but from a software development perspective. So for example, the case study I would use here is a company called Swedish. They basically, this was Swedish healthcare in Europe, and what they did was they basically built a Power App. This was using Microsoft Power Apps to be able to facilitate patient management in terms of hospital beds, right? So in this particular scenario, they had all these patients coming in. Many of them had COVID, some of them didn't. They were trying to figure out how to manage the hospital beds to get the most patients through and to manage all that. So they built a Power App. And they built this tool set within the space of a few weeks to be able to facilitate the management of patients in the response to COVID. Okay, and so if they had to go out to get a software development group to build this, it could have taken it might have taken months or even years to be able to do this. But this is something that they were able to knock up relatively quickly within the space of weeks. So this whole idea of having tool sets that allow end users to build applications, to build AI tools, to provision conversational agents, to build desktop automations to automate processes relatively easily, is what they refer to as this concept of democratization. And you're definitely seeing this in the healthcare space, as you are seeing it in other industries as well. The next trend that I would say in terms of healthcare is this issue of human augmentation. through things like artificial intelligence and the Internet of Things. So this refers to the idea that you're enhancing human capabilities to using integration. And there's the old joke, we are the Borg, if you're a Star Trek fan. But the whole point here is to say that more and more you're actually seeing technologies that are supporting people, everything from glasses to hearing aids to false teeth to Bluetooth connected pacemakers, right? These are all technologies that are connecting individuals to the internet, collecting more data, allowing this data to be used for diagnosis and for improved patient care, right? And so you're seeing a lot of this being used in the healthcare space, particularly in terms of IoT and collecting data for patients. And some examples of where you see this kind of idea of human augmentation using IoT and AI are things like cancer treatment monitoring, where they're using a real-time monitoring system to monitor the patient. Continuous glucose monitoring is another example of this kind of real-time telemetry through the Internet of Things. Closed-looped automated insulin delivery, where the insulin is actually delivering it based on patient needs. Connected inhalers to be able to monitor to see how well the patient is breathing from an asthma perspective, or if they have COPD as an issue. Things like ingesting sensors, right, to be able to monitor drug consumption. Smart contact lenses. All kinds of other different tools that people are using to collect more data about the patient to provide improved diagnosis and healthcare. Trend number 5 in terms of technology is this issue of, and this is really less about the technology, more about how it's being used. And it's just this concept that more and more governments are being cognizant of the ethical and privacy aspects associated with using these technologies, not just in a general commercial sense, but specifically in a healthcare sense, right? If you're going to use AI, ML tools to make decisions about people want to understand how they're using those tools. They want to understand how their private information is being used, what issues are related to that, and that kind of thing. So you're finding that, more and more governments are putting rules and regulations in. And this is something that, from a technology trend perspective, healthcare providers and regulatory agencies need to be aware of, and are asking a lot more and more questions about how to manage, this data. And you're actually seeing that, for example, some organizations getting huge fines. For example, in the EU, the GDPR handing out some, GDPR regulation causing some huge fines because people are not complying with these ethics and privacy regulations. So it's certainly a thing that technology providers and people are using technology are being more cognizant of. Trend number 6 in terms of healthcare is what they refer to as the empowered edge. So this is people used to talk about cloud computing, right? So we moved all the computing power to the cloud, right, given enhanced compute and more storage and more flexibility in terms of usage of the technology. What you're finding now is that people are, in the last few years, and Microsoft is certainly no exception to this, are making huge investments in terms of edge computing. This is not to be confused with simply moving the computing back to the local desktop or to the local server. These edge tools actually allow you to kind of merge local compute with cloud-based computing and transfer the loads back and forth, and one of the reasons why they're doing this, or a couple of the reasons why they're doing this, is because, just like you saw a few minutes ago when I had a disconnection with the internet, sometimes even with today's technology, I'm sitting on an NBN network, you still get connection issues, right? You still have reliability issues that occasionally happen. And clearly, from a patient perspective, you're not going to want, if you're going to have a tool set based in the cloud or some sort of diagnostic technology based in the cloud, you're not going to want to be put in a scenario where if you lose connectivity or something happens, even though it's very infrequent, that's going to impact the patient. So what healthcare providers and healthcare organizations are doing now is they're making more and more use of edge computing. And this is the idea that you have a combination of both cloud computing and local servers that can share the load, so that in the event that you end up with a disconnection of internet or there's a latency issue or that kind of thing, the edge server can take over and provide better support and better responsiveness. And so, for example, the example I have here of edge computing is using ECG for doing feature extraction, right? So here's an example in this particular case. This is an example of an architectural design where they would have an edge computer which would take the ECG data that would be at the local hospital or the paramedic. That data is being processed and analyzed locally to make recommendations. That information is also being pushed to the cloud to allow for advanced diagnosis and for recording and that kind of thing. But the actual ability to be able to make decisions is brought to the local edge server so that you don't have this issue of reliability due to lack of connectivity or latency or these kinds of things. The next trend that's going on in terms of technology is this issue of what they refer to as distributed cloud. This is the idea that organizations, and this is a little bit more of a technical view, but basically people are not just using cloud computing, they're not using edge computing, but they're making use of existing compute resources and spreading the load across a multiple different pieces of hardware and technology and solutions. And it's just, this is more of a back office thing from a healthcare perspective, but it's about providing reduced costs and better operational reliability, for healthcare organizations in terms of the technology you're using. So you're seeing distributed cloud being done more and more. The next trend that I'll talk about is trend number 8, which is autonomous things. So this is about using things like artificial intelligence to make decisions, to facilitate, various processes. They could be human assisted, they could be partial automation, they could be conditional automation based on certain use cases or conditions to take action to support the patient. You could have high degrees of automation, and you can have, full automation. Right. So some examples from a healthcare perspective in terms of automation. And there's a whole list here. My favorite is disinfectant bots. Right. So with the advent of COVID and the fact that cleanliness is even more important now, keeping everything at a high degree of hygiene level, not just in hospitals but everywhere else. The use of disinfectant bots, or bots that basically walk around and use things like UV lighting to reduce the incidence of infection and to basically reduce viral load in the hospital and that kind of thing, are becoming used more and more. But other examples that you can see in terms of automation, like for example, robot-assisted surgery, actuators, sensory prostheses, right? So people are using prosthesis, more automated prosthesis, endoscopy bots. So these are basically small capsules that can be used to do endoscopies. Targeted therapy or microbots, clinical training bots. So these are tool sets that clinicians can use to train themselves and to teach doctors and nurses and that kind of thing. Companion bots to provide people, with companionship who have various psychological problems. Telepresence, robot surrogates. So this is to me, this is the funny one. This is where basically the little bot goes around and has basically the little screen and the person's face is on the screen, just to give it a little bit more of a presence. So there's a whole bunch of different series of examples of where people are using automation, artificial intelligence combined with automation to be able to facilitate healthcare. Trend number 9 is this what they refer to as practical blockchain. So you guys have all heard of blockchain, right? It's been around for a few years now, since Satoshi Nakamoto came up with the concept and wrote his very famous white paper. What is blockchain? Blockchain is a technology which provides a decentralized, immutable, centralized ledger. Okay, and the idea, what does immutable mean? Immutable means that it's hard to change or it's a permanent record, right? Where would you use this in a healthcare perspective? You would use it anytime you need to coordinate between various functions, where you have a number of different individuals using the same healthcare records, and you want those healthcare records to be permanent records that provide a natural ledger or a natural history of what's gone on with the patient, or what you've actually done with the patient, right? So blockchain is certainly, as a technology, coming into its own. A lot of organizations are using blockchain technology, right? Some examples that you would see from a blockchain perspective in the healthcare space are electronic medical records, things like remote patient monitoring, where you have to keep track of the actual information, the pharmaceutical supply chain. One of the biggest uses of blockchain is in supply chain coordination. Being able to track drugs as they move through the supply chain to make sure that, for example, people aren't stealing them if they're restricted class of drugs, right? Or tracking the drugs to be able to know that if they've gone past their use-by date, or what they were used for. It's always very important to be able to track where a drug was used and what patients was used and why, right? So they're using blockchain to do that. But they're also using blockchain just to manage basic hospital supplies as well. And then other things that blockchain can be used for is things like health insurance claims, to be able to track a health insurance claim to make sure people are not claiming for the same condition multiple times, or making incorrect claims, that kind of thing. And so you're seeing blockchain as a tool set. Again, it provides this immutable, decentralized, structured ledger, a source of truth, right? You're seeing it being used more and more from a healthcare perspective. And I think one of the things, as someone myself who, for example, does a lot of work with St. John's Ambulance, I know that when I walk up to a patient, one of the most important things to me is having good information. If I can get that information more quickly and it's accurate information about what's going on with the patient, then I can help them more quickly, or I can point them to the right direction in terms of who needs to look at them from a diagnostic perspective. So this whole idea of providing better records, better systems, and having better patient information, while it's also maintaining the issues related to privacy and security, is absolutely important. And I think blockchain is going to provide could be a critical component of that in the future. My last technology trend in terms of healthcare that I'll refer to is AI security. The issue here is that if you're using artificial intelligence tools, in combination with, say, some sort of Internet of Things, to collect patient information and to make diagnostic recommendations or to provide alerts to the clinician in terms of something going on from the patient's perspective, or even just using AI to make decisions about managing supply chain in terms of the amount of drugs you're going to need to keep on stock, or using AI to make predictions in terms of how many nurses you're going to need on staff because of patient load and that kind of thing. The more you're going to be relying on it, the more security is going to become more important. I was at a presentation a few years ago where the Dean of the University of Sydney Business School suggested that IoT and AI were probably the two single biggest threats to security in the modern age. And what he meant by that was as we connect more and more data and information into the internet, and as we use AI to make decisions about that data, people hacking into those systems can do more and more serious things. For example, about 2-3 years ago, there was a massive recall of internet-connected pacemakers. So these are pacemakers that were connected via Bluetooth to a base station, so that as the patient walked around their home, it would collect information about their heart, that would send that to the cardiologist. The cardiologist could then make changes to the pacemaker and adjustments real time through that Bluetooth connection. Unfortunately, what they realized in that particular pacemaker is that they didn't actually properly secure the Bluetooth connection between the pacemaker and the base station. Huge security issue, right? You can hack into it, you can do nefarious things to the person's pacemaker. So as we rely on these technologies more and more, as we use them, as we connect patients more and more to the internet, as we collect more data, as we make decisions using that data, then security is going to be absolutely critical. And when you're having that security, AI security is not just about securing the decisions that we're making using AI, but it's also about using AI to identify when people are hacked into systems and that kind of thing as well. And so what you're finding is that people are actually using artificial intelligence more and more to identify when there are problems from a security perspective, in terms of the technologies that you're putting into place. So that, in summary, that's the 10 technology trends that I would see are coming through, particularly in the healthcare space. This idea of hyper automation using a combination of AI and robotic process automation and business intelligence to provide diagnostics, but also to provide back office automation to provide better responses to patients as they have queries and inquiries and that kind of thing, and manage back office processes from a healthcare perspective. This idea of multi-experience, using things like AR, VR for training purposes, using it for things like surgery, providing better experiences to people when they have questions about from a healthcare perspective, things like conversational agents, right? Democratization, seeing new tools being developed by the vendors like Microsoft and other ones like Google and that allow people to build a lot of these technologies or use a lot of those technologies themselves and be more agile in their application of the technologies. Human augmentation, this is referring to the application, as I said, of IoT, connecting humans up to the internet, collecting more information about them to be able to make diagnosis, to be able to identify when something's going wrong from a clinical perspective, when you need to help them out. Things like the empowered edge, bringing more of the edge computing down closer to the actual, to the theaters, to the hospital, that kind of thing, just to provide that reliability and to address any kind of issues that go on. Things like autonomous things to basically automate and help provide automated responses from a healthcare perspective and to warn, identify when there's a problem. Practical blockchain from a logistics perspective and from a medical records perspective. Things around transparency and traceability, these are just things that we're going to have to worry about as we rely more and more on the technology. And as I said, relying and having more, doing more about security with regards to AI and IoT as we rely more and more on these technologies. So that was it. That was my sort of presentation of the top 10 trends in healthcare technology. As I said, as I began the presentation, right, it used to be traditionally that people were using technologies to support healthcare and to support what people were asking for. What you're finding more and more is these new technologies are coming along and people are finding new ways of solving old problems or to improve the patient's patient care. So it's, I think, important that, in any industry, but also in the healthcare space, people who work in this space start to understand more and more about these technologies to be able to think about how they can adopt them into their organization. Anyways, that's all I had for this evening's presentation. I don't know, Michael, were there any questions?
Yeah, David, there are. So we have a question from Hamad. Are bots prone to inaccuracy, specifically in medical, where exactly info is crucial?
I don't know if I'd use the word inaccuracy. I think the challenge with bots, and it depends on what you're talking about. If you're talking about AI-based decision tools, or if you're talking about automation bots. If you're talking about AI-based decision tools, I think the bigger issue with regards to using AI to make decisions is with regards to the data sets that were fed into it. So clinicians have to make sure that when the bot was trained, it was trained based on, or the AI was trained, it was trained based on a data set that was similar to what they're applying. So if it's a scenario or a particular clinical scenario that's out of the range of what the bot was actually built for, or on the edge case, then you're going to end up with issues, right? In terms of the accuracy of the bot, I don't know if they're prone to, the physical bot in terms of robotic automation. I don't know if they're prone to inaccuracies, but I think that they're never going to replace the clinician. They're never going to replace the surgeon. They're there just to support them. I think a lot of people have unreasonable expectation sets about where the current state of the technology is certainly something there to support the clinician, to support them in their diagnosis, to support them in terms of, doing various things, surgeries, that kind of thing, but they're never going to eliminate the need for that. So yeah, I don't think it's necessarily an issue of inaccuracies, but I think there are issues in terms of how you use the tool sets. I don't know if I've answered the question, but anyways.
David, there's another question. Is there anyone working on tablets to be available for making support such as pastoral care to patients?
Working on tablets to make support for pastoral care to patients. I've heard of that, but to be honest with you, I don't have specific examples of vendors who are doing that. If someone sends me an email afterwards, I can go and find some information for them and send it through to them. So,
okay. You talked about the issues of digital ethics and privacy. What do you think about the government's COVID Safe app and the issues of privacy that it raised when it was first released?
Yeah, so that's an interesting one. So I have done a fair amount of research around IoT and privacy and digital ethics and the use of persons' private data. I think what both the COVID Safe app and also, if you remember 2 or 3 years ago, when people, when they were trying to do the central register collecting for patient records, and that kind of received a lot of negative press because people were concerned from a privacy perspective. Privacy is an interesting thing. There's a lot of research that's done around privacy and how people respond when they're asked for private information, not just private information about themselves from a health perspective, but also from a financial perspective and these kinds of things, right? One of the things I would suggest to you, and there's a lot, I don't want to go into a lot of detail, but where the government made the mistake was that when you're giving away, when you're asking someone to give away private information, usually when you do it in the form of an exchange, right, people are more willing to make that trade-off, right? So if you give me this private, information, right, and then say if you're applying for a bank loan, if you give me this private information, I will give you the bank loan, right? When they put the COVID Safe app in place, they were asking people to give a lot of information about their physical location and their background, even though it was all secure, without any kind of immediate exchange. Yes, there was the potential to protect themselves against COVID, right? But it wasn't an immediate exchange. What you find now, so that whole app has fallen to the wayside, but what you find now is that people scanning QR codes is being very, very effective in terms of tracing where people have gone for venues and stuff like that. And if you think about it, right? It's that exchange, right? If you want to get into the venue, you got to scan the code, right? So there's a trade-off, right? So if you give you some private information, you can get access to the venue to have a meal, right? And so this just relays back to how people think about privacy and how they share information, not just from a healthcare perspective, but from a financial perspective. If you do it in the form of an exchange, people tend to be more willing to give that information. If you do it as just give me some of your private information that may be used in the future, people are less willing to do that. And so I think the same sort of logic applied a few years ago when they were trying to create that centralized health record. People were like told, "Oh, put all that information up there." You know what I mean? And you might need it in the future, but the government didn't really do a good job of articulating the benefits. And from my perspective, as someone, like I said, who worked in St. John's Ambulance and has worked around healthcare for a number of years, that's a real shame because, as I said previously, being able to have that information at your fingertips from a clinical perspective makes it much more easier to come up with an effective diagnosis or to identify when someone's got something seriously wrong with them and where you need to take it to another, more senior person. Anyways, that would be my answer to the question. Are there questions, Michael?
Yeah, there are. We're getting some good ones. In your opinion, David, which among these trends is or are the most critical ones poised to impact big pharma globally? A, globally, and B, in developing regions?
I think AI is probably one of the bigger ones that's going to be applied from a pharma perspective. AI, and what I mean by AI is more from a supply chain. So I actually have a number of friends in the pharmaceutical industry who are working on problems using artificial intelligence to basically identify or predict when you need certain drugs or keeping the inventory of drugs. So one of the issues, that you have is that you want to have the right amount of, the various drugs and the various, medications, for various times of the year and various locations and that kind of thing. And I think from a supply chain perspective, they've always kind of struggled a little bit to have effective forecasting of patient need. So what a lot of organizations are doing now is they're looking at using AI from a supply chain perspective in pharma to be able to identify, and forecast the demand for various medications. And that idea of using AI for forecasting is not just from a pharmaceutical perspective, but it goes right down to the hospital level and using AI to be able to, for example, predict when, the availability of beds, to make recommendations in terms of how much, nursing and other support staff you need to keep on for various times of the day or the month, and that kind of thing. So I think AI in the supply chain space globally, but also in more emerging markets is going to be, you're going to see it more and more because there's just a huge amount of opportunity, I think, to manage those supply chains better and to do better forecasting and better management.
Okay, great. David, you talked about the use of AI in diagnostics for healthcare. What do you think are the limitations of this technology in a healthcare context?
Well, as I said, there's a number of limitations that come to mind. The first limitation is, I think, so a lot of these, there's different forms of artificial intelligence. Probably the most common one is what they refer to as supervised learning. And supervised learning says that you use historical data to predict the future, right? So if I've seen a particular patient that had these sort of characteristics, this may suggest that they have this particular condition, right? So you're assuming that historical is a good representation of the future. A lot of times when people don't understand how these AI tools are built or where the data that they were used to build the models, they make incorrect assumptions in terms of the AI's ability to be able to make a recommendation, right? So I think that to me is probably one of the bigger issues from a healthcare perspective in terms of the use of AI. Other issues that come up, and so that to me is kind of like this unrealistic expectation set, or not actually understanding how the models are built. And this to me is probably one of the biggest risks of AI, not just from a healthcare perspective, but from an industry perspective, which is that people use these tools without actually understanding how the models were built in the first place and what their limitations are. I think other issues that will come out from a healthcare perspective, as I previously referred to, are the issues of privacy or access to data, right? AI tools are only good as the data you feed them. If the data is incorrect or incomplete because of privacy issues or because the patient hasn't provided it, or these kinds of things, then the models will break down and they won't be as effective. The other thing that I think people have to recognize when they're building AI tools is they're not something that you simply set and forget. There's something that you have to continue to monitor. You need to quality assure. You need to make sure that if the data is changing in the source systems, that the AI is being properly trained and updated. And oftentimes organizations don't think about that when they use them. So that would be my thoughts.
Okay, I think that's about it. If anyone else has a question, feel free to quickly throw it into the Q&A. I know Kylie is interested in talking to you, David, so we'll talk offline about connecting with her. But other than that, it looks like that is a wrap. Ladies and gentlemen, thank you very much for your time, and thank you, David, for such a fabulous presentation. We will make sure that we get this uploaded onto our YouTube account. So Microsoft Reactor has a YouTube channel where we put our events on. So we will work to get that up. Put that into the link. And other than that, I wish you all a great day, great evening, great morning, wherever you are. And we look forward to welcoming you to a Reactor session again in the future. Thank you, everyone.
Thank you. Have a good night or a good day.